Family is the backbone, I think, of our experiences for when we're going through hard times, and we've gone through some hard times. About 22 years ago, I was experiencing some discomfort, and so I did go to my GP. I thought I had a bladder infection. It was determined that I had some fibroids, small fibroids. She indicated we would just get me onto the surgery wait list. In the meantime, they grew, and they got bigger, and they started pressing on other parts and other organs. And so there was a lot of discomfort. So I ended up being on a wait list for 4 years. I have an appointment to talk with the surgeon, and she is indicating that the removal of the fibroids is not really gonna solve the problem, that they have grown to the point where I required a hysterectomy, which is not what I thought was gonna happen at all. I felt a little blindsided by that. And then she proceeded to then talk about the different options. If you have your ovaries removed and the fibroids, of course, then you go immediately into menopause, but it'll be over in a year. If you don't, and we just remove the uterus, you go through the slower process of regular menopause over 10 years or so. I didn't have any other information at that point sitting in that office to go on, so I just waited out on a timeline. 1 year, 10 years. I guess I'll pick 1 year. And I can remember lying there thinking, oh, I hope I've made the right decision.
Women, such as Lynne, they're really dealing with a bit of a fragmented system, and they're not necessarily getting relief of their symptoms, all of which I think is very frustrating, and they don't know where to turn either for education or for clinical care.
I was anticipating a rough year ahead, but I figured it was worth it, that I could hang in there and get through it if it meant that I could have my normal life back. It didn't go that way. And didn't understand the extent of the size of the fibroids that came out of my body. The largest one was the size of a grapefruit, which was mind-boggling to me. That was the beginning of extensive, frequent hot flashes that went on for years. I would have a hot flash every 30 minutes for 24 hours a day for the next 10 years. I struggled with weight gain. After I gained 50 pounds, thinking I can't possibly gain any more weight. And I was so wrong. I gained almost 100 pounds in the following years after the surgery. It stretched into 5 years, and then it stretched into 10, and eventually landed on 15 years. I didn't really want to be this way around my family or my friends or the people at work. It just carries with it shame. What's wrong with me? I think that's where I kind of got to. What's wrong with me? What I've come to learn is it wasn't anything wrong with me, it was what was happening to me.
This is a population that generally is spending a lot of time caring for other people. They're caring for their parents, they're caring for their children, they're busy with their careers. So not a population that has been out there really advocating for themselves. It has been an area that is minimized by the medical community in general. So, it's just hot flashes, it's a natural transition, you'll get through it, and perhaps does not give them the weight that they should have in terms of their impact both on their physical health and on their psychological and social well-being as well. I anticipate that once we have a mature women's health program, that her experience or the experience of her daughter or her granddaughter would be fundamentally different. That she would have the resources at her fingertips to gain information. She would know where to go for advanced care. Her provider would be able to request a second opinion consultation or provider-to-provider consultation, and that her care would be seamless, women-centered, and meet all of her needs.
My hope and belief for the future is that we can change things for the better. By being here, by supporting mature women's health, you're making a difference for women like me, and also for women like my daughter and my granddaughters for the future, and it's so worth doing.